This is Nicole from Your Nursing Tutor, and today I'm going to be continuing the series that's going to help you with the 4 boring things you need to know about fluids and electrolytes that you probably think you might know about, but I, as a professional nursing tutor with over 15 years experience, I would almost guarantee you do not know it as well as you think you do. So last week we talked about osmosis and diffusion. This week, we're going to talk about oncotic pressure and hydrostatic pressure. So these two you might actually not know about. Most people have heard about osmosis and diffusion, and I talked about that a lot in the last episode. So make sure you go back and listen to that. And you actually might want to go back and listen to 2 episodes ago first, where we talked about homeostasis, because homeostasis is really the guiding principle under which you can understand these 4 topics even easier. And this is great for you whether you are a brand new nursing student in fundamentals of nursing, because you do need to understand this basic stuff for that, or even if you're more advanced in nursing school, if you're in med surg or further, because a lot of times by the time you get to med surg, you sort of forget to study the basics. That's the nice way to put it. But nobody tells you to do this, right? And you don't have time. You're pulled in many different directions. A lot of the tutoring students I work with are adult learners, so many are working or have families to take care of. You have grown-up responsibilities. And so you're trying to study efficiently and maximize your time, which studying stuff that's normal doesn't always seem like a priority. But I'm here to tell you that it is the most important thing you can do. It's the best way to maximize your study time, is to make sure you are solid on the foundations. And so that's why I'm going to help you out today. Now, if you want more help after this, I have a free overview of the Silver Bullet study system, which is going to help you build your foundation no matter where you're at in nursing school, and also study in the way that experienced nurses think so that you can learn to think that way too. Because let's be honest, that's how you're being tested in nursing school, like a nurse. And so it's different than any other kind of test you've ever taken before nursing school, which means you have to study differently than you ever had to study before nursing school. So to get that, you just have to go to my website at yournursingtutor.com/SBSS. That's SBSS. It stands for Silver Bullet Study System, because it is the last study system you will need for nursing school. And it applies to all learning strategies, by the way, which I'm planning on doing a podcast episode in a few weeks about learning strategies and the best way to study depending on your learning strategy. So stay tuned for that. So let's talk about our last 2 of our 4 boring fluid and electrolyte topics. And I call them boring facetiously because I don't think they're boring. I think they're fascinating. But they get taught in a very boring way sometimes because it's very dry. So like I said, go back and review osmosis and diffusion because that's important. I'm not going to talk about that today. I'm going to talk about oncotic pressure and hydrostatic pressure. So one thing I am going to review real quick is that when it comes to these things, it's all about the movement of water. So if you recall, our bodies are mostly made up of water, no matter what part of the lifespan you are in. And the other thing you'll notice is oncotic pressure, hydrostatic pressure. Okay, it has a lot to do with pressure in the body as well. Most of the time, this is going to be related to water as well. Water pressures. I mean, if you think about it, I asked one of my one-on-one tutoring students this recently. And so I'm going to ask you this question and see if you get the same deer in the headlights look when I ask it. My question is, what are you actually measuring when you measure blood pressure? What are you actually measuring when you measure blood pressure? Because a lot of times these are things that as nurses, even as nursing students, you do like every single day, whether you're doing it manually or with an automatic blood pressure cuff. And of course, a lot of times students will just say, oh, well, it's 120/80. That's what you're measuring. But what does that mean? What does that mean? And that's why when I tutor, I always say it's like you're interpreting the body. It's like you're learning 2 languages. I should talk about this again in another episode also. But it's like the numbers 120 and 80, they mean something in the body. They represent something, and it all has to do with pressure. Okay. If you guys want me to talk more about that in a future episode, let me know. Okay. But let me move on. I'm going to stick to oncotic pressure and hydrostatic pressure today so I don't get too off topic. But my point is, there are so many things in nursing school that if I just ask you, what does this really mean? And if you realize you don't know, then that is one of your clues. That's one of your red flags that you're not studying effectively in nursing school. You might be studying a lot, and I'm definitely not saying you're lazy. I rarely meet lazy nursing students. Rarely. But what I do meet is a lot of really hardworking nursing students who are studying way too much, doing the wrong types of studying. And so they're not getting the results they want. And I can find out within 2 minutes whether that's you when I do a tutoring assessment, just by asking questions like that. What is blood pressure? Right? So what is blood pressure? Okay, I'll tell you because I know people want to know anyway. And then we'll go on to oncotic pressure and hydrostatic pressure. So blood pressure, if we look at there's systolic and diastolic. The systolic pressure we're measuring the pressure of the blood, which remember is mostly water. So it's the pressure of the blood that it's exerting on the force on the walls of the artery when the heart is contracting, specifically the left ventricle, right? So when the left ventricle contracts, of course, it is pushing and squeezing that blood forward with more force, with more pressure. And that, of course, puts pressure on the artery walls. And so when we are measuring that systolic number, we're measuring a pressure that we can interpret. It tells us something about how hard the ventricle has to work in order to be pushing that blood around the body. Okay. The diastolic number is similar, but it's, of course, when you probably know when the ventricle is relaxed. So it's how much pressure is the blood pushing on the artery walls when the ventricle is not contracted, when it's relaxed. And that information tells us, again, something about how hard the heart has to work in order to get blood around the body, and whether it can, when it's in a rested state too. But it has to do with pressure and it has to do with water. And that's related to what we're talking about today too. So if you didn't know that, if you didn't make that connection, connect those dots between what blood pressure really is and what it means in the body, because now you can understand, why is it that high blood pressure is a risk factor for so many cardiac diseases? Heart failure being a huge one of those. Well, it's because when you have high blood pressure, that's an indicator that the heart has to work harder because it's pushing against higher pressures. It has to push harder to make the blood go around the body so that it can do its normal job. Okay? It all comes back to normal. It all comes back to normal. Studying with the silver bullet study system, like I said, helps you to make those connections easier. So bringing that to the oncotic pressure and hydrostatic pressure today, those are two factors, just like osmosis, just like diffusion. These are all factors that play into things like as simple as blood pressure and affecting the blood pressure. They're not the only four factors. There's lots of other factors since we're talking about blood pressure. I wasn't planning on talking about blood pressure today, but that's where this virtual tutoring session went on this podcast. But there's other things, of course, that play a role, like possibly arteriosclerosis or other medical conditions, fluid volume status, things like that. But four big ones are also osmosis, diffusion, oncotic pressure, and hydrostatic pressure. So let's talk about oncotic pressure now. Oncotic pressure, I love saying that word, by the way. It's such an unusual word. It's just, it's fun to say to me. Oncotic pressure. If you're somewhere where people aren't going to look at you weird, say it out loud because it's going to help you remember it. Oncotic pressure. And if you're somewhere where people are going to look at you weird, just whisper it. Like, do it. So oncotic, I'm going to spell it for you just in case you haven't seen this word in print. It's ONCOTIC. So oncotic pressure refers to proteins, basically. So it is, think of it, this is, Nurse Nicole's 4th grade definition of oncotic pressure, okay? It is the magnetic pull that proteins have on water, okay? A magnetic pull that proteins have on water. So you would think, well, how is that different than osmosis? Well, osmosis is the movement of water. So it's the water doing the moving that goes to dilute other stuff. With oncotic pressure, the water is sort of it is the thing moving, but it's not moving of its own volition per se. It's being pulled by the presence of the protein. Okay. So that's just the slight difference. Now, oncotic pressure is going to be mostly influenced by albumin. That's probably a protein you've heard of. Of course, our body has many proteins that it uses, but the most common, the largest protein that is in our blood is albumin. Okay. And that's important to know because when we are in nursing school as nurses, when we are thinking about these fluid shifts, almost always, we are thinking about them in terms of the blood inside the blood vessel. Okay, the blood inside the blood vessel. This is going to be important when you're studying IV fluids too. Spoiler alert. Okay, because IV fluids are always being compared to the blood as well. That's a whole other podcast episode. But so we have with the oncotic pressure, it's mostly albumin pulling water to it. So how can you apply this in your nursing studies? Now, I will be honest, oncotic pressure is not going to be the most common of the 4 factors that you're going to be looking at. Osmosis and diffusion, you're going to use those way more commonly in your mental gymnastics when you are studying in nursing school. But I will tell you one situation where oncotic pressure is huge and will definitely help you with understanding is when you get in one of your med surg classes and you're studying burns. Okay. Because when you study burns, what you find is that in the acute injury phase of burns, your blood vessels change their permeability. Okay. And if you remember, permeability is just the ability of a barrier to allow certain things through, but not other things. And when it comes to the blood vessels, albumin is normally too big to fit through the blood vessel walls. So it is not semi-permeable to albumin under normal circumstances. But when somebody has a significant burn injury, the permeability of the blood vessels changes. The holes get a lot bigger, and now albumin can escape, and it does. And so albumin is fleeing the blood vessels, which means they're going into the interstitial spaces. Okay. And when they leave to go to the interstitial space, guess what follows? Water. Because the oncotic pressure inside the blood vessel is dropping in the blood vessel, and it's increasing in the interstitial space because that's where all the albumin is going now. So the water, this is one factor, the water is going to follow it. Now, is that the only factor that influences water? No, of course not. That's what we were talking about. Once we understand oncotic pressure in isolation, we can zoom out, and now we can see how that interacts with all of the other factors that are influenced from the water and kind of add it up like a virtual math equation and figure out, okay, which direction is the water going to go? But obviously, if you're in an acute situation where this is happening, it's not going to be good all around. and in a burn situation, you would expect that the factors are not helping with homeostasis at the moment, and things are going to be, a lot of water is going to be leaving the blood vessel. And this is why circulatory collapse is one of the biggest, immediate complications that we are dealing with in terms of, after an acute burn injury. So we're going into circulatory shock, basically. And because the albumin is leaving the blood vessels is one of those big reasons. So what do we do about this as nurses? And by the way, I am walking you through the 4 steps of the silver bullet study system right now. We just predicted symptoms based on what we know about normal, what we know has broken, and then we predict the symptoms. And they make sense, right? Like you can totally understand why the blood pressure would decrease if the albumin is leaving the blood vessels, right? Because you're losing water too. So if you don't have that water, you're not going to have that blood pressure levels. And if that happens, then the blood can't do what the blood is normally supposed to do, which is deliver oxygen and nutrients around the body. And if the blood can't get the oxygen around the body, then the different body systems that require oxygen are going to suffocate. We didn't need to look that up in a textbook. It just makes sense based on what you know about normal, what you know is broken, and then you can predict. Because you do have all the critical thinking skills you need to be successful in nursing school. What you need is just practice and guidance for how to apply your existing critical thinking skills to the nursing content. And that's what the Silver Bullet study system helps you with. So then the last step of the Silver Bullet study system is, what are we going to do about it as nurses? This is the nursing care. If you have trouble prioritizing nursing care, this is going to help you, because we just have to think now, what do we do about it? And if we know the problem is, it's not just that their blood pressure is dropping and they're in circulatory shock. I mean, if that was the case in some situations, not burn situations, but in some situations, you would just, quote unquote, fix that by giving them some normal saline, right? That's surely going to get up the blood pressure, but not in this situation. Not in this situation, because we've connected the dots. And if we give normal saline, guess where that normal saline is going to go when we put it in that patient? It's going to go right to the interstitial space being pulled by that albumin. Okay? Oncotic pressure is going to happen here. And then you're just going to get more swelling and edema, but your patient's still going to die. What we need to do is we need to give fluid and albumin. We need to get albumin back in their blood vessel. And that's why one of the treatments you would expect in the acute burn situation is going to be giving them albumin. Because the doing so, especially as the permeability of the blood vessels starts to go back to normal, doing that is going to increase the oncotic pressure, pulling water back into the blood vessel. Does that make sense, guys? Because it is all connected. It's all connected. Okay, so that's the biggest place where you'll see oncotic pressure. Now, hydrostatic pressure is I'm going to be honest with you, it's the least used, I think, of all, but it's good to know. It has, because it has its place, and it's a big player in blood pressure. So hydrostatic pressure, the fourth grade explanation, is as simple as the fact that water takes up space. And anytime you have water or fluid, it exerts its own pressure outward. So the easiest way, I think, to visualize this is with a water balloon. When you have that little rubber water balloon, you hook it up to a hose and you turn the water on, the rubber expands. Why does that expand? Have you ever thought about that? What is it that makes the rubber get bigger? Well, because the water that we're putting into it takes up space. And when it takes up space, it exerts a pressure to push the things around it outward. Not because rubber is stretchy, it stretches instead of breaks, right? But and same with our blood vessels. Our blood vessels, thankfully, are stretchy. So they also will expand instead of simply break. Now, obviously, what should pop in your mind is that there are some situations where our blood vessels become less stretchy, like arteriosclerosis. And that will, of course, reduce how stretchy the blood vessels can be, which means it's not going to be as easy for the water to push it out and stretch it out, which means there's going to be higher pressures. There's going to be higher pressures. And so this is hydrostatic pressure. It's the force that the water itself exerts outward. So just compare oncotic pressure and hydrostatic pressure real quick, just because I'm going to zoom out just a little bit with these two to show you how they can, an example of how they can interact. Before I do that, let me tell you with hydrostatic pressure, one more thing in isolation. So the hydrostatic pressure, if it's in the blood vessel, let's say if you have high fluid volume right now, higher than normal fluid volume, then it's just like having an overfilled water balloon. It's pushing out pretty hard and it's at risk of breaking, right? Now, we're not usually worried about our blood vessels being at risk of breaking, but when the water is pushing out with that strong hydrostatic pressure, there's a higher chance that it's going to leak out, because now it's pushing so hard that some of that water is like, okay, I'm out. This is too much. Too much pressure. I'm out. and then the water moves into the interstitial space for that reason. Okay. It can reverse if you have a lot of water in the interstitial space. It might say, yeah, there's too much here. We need to go back in the blood vessel. But you might ask, if you have something like edema, wouldn't that be a lot of pressure, hydrostatic pressure out and not as much in? The answer is yes, maybe. It depends. You have to know what the blood pressure is. A lot of people with edema have high blood pressure, and that's why the edema happened, because the high blood pressure has a high force of hydrostatic pressure that overcomes some of these other three forces: the osmosis, the diffusion, and the oncotic pressure, which are, ideally everything's working to keep just the right amount of fluid inside the blood vessel to maintain homeostasis, which would be around a normal blood pressure, and no edema in the interstitial space. So let's zoom out. So how could oncotic pressure and hydrostatic pressure work together? Well, the oncotic pressure works because, remember, the albumin is in the blood vessel. It's got a magnetic pull pulling water into the blood vessel. Now that the water's in the blood vessel, the hydrostatic pressure exerts a force that's really pushing the water out. Okay, so we have the oncotic pressure pulling it in, and we have the hydrostatic pressure pushing it out. So if you thought about it as a pretend math equation, the direction the water moves is going to depend on which force is pushing harder. So or pulling harder, if the oncotic pressure is stronger than the hydrostatic pressure, then more water is going to stay in the blood vessel. If the hydrostatic pressure is stronger than the oncotic pressure, then more water is going to leave the blood vessel. And that's as simple as that. You don't have to figure out the exact numbers all the time, but what we're doing, this is an example of where I call the mental gymnastics, is you think through these concepts. You include the osmosis and the diffusion and the oncotic pressure and the hydrostatic pressure. And whenever you're studying a disease process, and they almost always involve fluid shifts, you think through what's going to happen to the fluid. How is this disease process changing the dynamics between these four factors? And you can use that information, understanding how they normally interact together to maintain homeostasis, to what they're doing now that something has broken. Well, how do they have to change? How are the factors and the influences changing now that something is wrong? And what's going to happen as a result? And then you can make predictions about what symptoms you're going to see, and you're going to be able to make predictions about what kind of medical care to expect and what you're going to do about it as a nurse. So that's oncotic pressure and hydrostatic pressure. Hopefully you have a better understanding of it now. You really cannot study this stuff too much. Well, you can. I take that back. So many nursing students study stuff too much. But when you have the foundations of these four things, it's going to help you so much. Now, if you want a framework to study them, remember, I have my free Silver Bullet Study System overview that you can get. Just go to yournursingtutor.com/SBSS. And it's just a 10-minute overview. It's enough to get you started. There's a download with it. If you want more help, remember, I tutor. I'm a professional nursing tutor. I do one-on-one tutoring. I have a group tutoring membership, which is a great lower cost option, because a lot of nursing students are on a budget, compared to my one-on-one tutoring. And there's also some self-study courses. I have a more in-depth course on how to use the Silver Bullet Study System that's available as well. And you can get all of that information on my website at yournursingtutor.com. Now, before I leave today, I would greatly appreciate it if you would just hop on over to Apple Podcast and give me a 5-star review for this podcast. It really helps other nursing students to discover this and know that there's a lot of good information in this podcast to help you get through nursing school confidently and calmly. And maybe even tell your instructor about it, because I bet your instructor is often looking for resources to give other nursing students as well. So you have a wonderful day. And as always, good luck on your nursing school journey.